These are my financial interests. As you know, the changing profile of the cataract patient, younger, active in life. More importantly, the expectations are very, very high as far as the vision is concerned. How many of you have had this problem? 6, N6, and the patient is unhappy. How many of you? I'm sure everybody has gone through this. I'll just go through some different case scenarios since we are running short of time. Refractive multifocal 6.5 N5 vision, long time back 2003, 2004. You can see it's a rezoomed lens, beautiful rexes like a femtorexis, glare halos, and these are starbursts. It can be very troublesome to the patient. And what is important is a type C personality. When they see the glare and halos, they become type A personality. So that is a big problem. And this patient sued me, but fortunately for me, she died of myocardial infarction. Okay. Number 2 is 55-year-old female, Alcon Acrisoft lens. You can see patient not happy. What is the reason for this? You can see a crack on the lens. Can you see a crack on the lens? Okay. This intraoperatively, I noted this because one of the OT assistant don't hold the optic of the lens with the McPherson forceps or any forceps for the matter, whether it's a multifocal or unifocal lens, you can have a crack. I thought it was just a small mark there, but it had a crack, and patient had a polyopia and a light scatter, and she went to another ophthalmologist in Chennai, and that ophthalmologist said there are 2 cracks. One crack is on the lens, the other crack is the surgeon who's operated on you. So that is the thing. And she became very furious and she sued me, but I won the case for that. Just to show you that different types of multifocal lenses, we have a lot of problems. We need to know how to deal with this. Again, another patient with a multifocal lens, you can see here, this mainly because of the glistenings, which is very common with the Acrisoft lenses. The glistenings actually cause, especially in a multifocal lens, the Restore lens, which Restore Plus 4 lens, which I used long time back, about 10-15 years back. You can see the glistenings can cause a decrease in the contrast sensitivity as well. So again, as you know, the glistenings can be a real problem. Again, another patient with multifocal lens, the decreased contrast. You can see what is happening is there is only a one line on the posterior capsule. But in a multifocal lens, this line is good enough for 2 or bad enough for them to have a decrease in the contrast vision or the visual acuity as well. So don't expect the posterior capsule opacification to occur. Even the YAG rates in the multifocal lens are much higher, not the posterior capsule opacification, but even if the line or the wrinkle on the posterior capsule, you can see there's a line on the. Once I did the YAG laser capsulotomy, the patient became very happy as well. Again, patient not happy. Typically, the patient says, I was happy, my vision was very good. Past few days, it's not very good after a couple of weeks. And if you see that the fundus is fairly normal. So, I feel that OCT is a very, very important tool. Okay, because the OCT can pick up this OCT's CMEs, which normally in a clinical examination on 90 diopter, 70 diopter, or indirect ophthalmoscopy cannot do. But the patient is not happy. Very typically, they say decrease. Once you put the patient on non-steroidal anti-inflammatory Nepafenac and steroids, the patient became all right as well. Again, another patient with the thickness, residual astigmatism. If you have residual astigmatism multifocal lenses, they will kill you. Okay, and you see, this is one of the biggest problems. You can see another patient with the thickness multifocal plus 24.5 diopters, 618 N18. Okay, see the refractive or post-operative refractive plus 2.5 in the right eye, plus 2 in the left eye. Okay, if you make them myopic, they will just leave you. But if you make them hyperopic, they will decapitate you and bury you. Okay, so that's what they will do, because in hyperopia the problem is in a multifocal lens they will not be able to see distance, intermediate, reading when you have hyperopia. Why this hyperopia has occurred? Because of this dense asteroid hyalosis. This patient had dense asteroid hyalosis in both eyes. The OCT was normal. I made a mistake of going in for a multifocal in this patient. So if you have dense asteroid hyalosis, probably is not, because it alters the refractive index. You cannot get the proper lens for this patient. And multifocal probably would have been, say, I discussed this with Samuel Mascott, Warren Nill as well. You can see that it's one of the reasons. If you have dense asteroid, even the OCT macula is normal, don't go for multifocal because you cannot get the power of the lens properly. Again, a crystal lens, I was one of the largest users of crystal way back in 2008, 9 and 10. You can see crystal lens, what happens is a very good lens, accommodating lens. All of a sudden, the crystal lens can move forward and talk. That's called the Z syndrome, and the patient can have a myopia. Again, another patient with a hydrophilic lens, three-zone refractive multifocal lens. Because of capsular phimosis, the multifocal became shifted backward, and there was an hyperopic shift of the patient. Once they did a YAG laser capsulotomy, it became all right. Again, another patient, you can see the ocular surface. Look at the ocular surface in multifocal lenses. You need to optimize the ocular surface before you take these patients. But post-operatively also, you have to put them on lubricant, especially when they are using a lot of other drops as well. And ocular surface disease is one of the important things you can see. Again, another patient with a symphony. You can see here, this is a gynecologist, and she said, I am not able to differentiate between the ureter and uterus, which is a very common problem among gynecologists. I put a symphony, very happy, 6.5 N6 vision. But the problem is, she said, I've got this ring around the lensing. It's called negative dysphotopsia. I said, you have the other eye done, madam, you will be all right. Other eye done, again, what is happening? 2 negative dysphotopsias on both eyes, 2 semicircle. What do you do for these patients? Very difficult problem to treat. So fortunately for me, this patient, husband became very sick. She had a CA rectum. So she got distracted. I told her to wait for 3 months, 6 months. Husband became very sick, got distracted, and completely forgot about the negative dysphotopsia. Otherwise, very difficult to treat. I'm sure, I don't know what you do, Ramurthy, for negative dysphotopsia. Very difficult because you need to go in and probably do a reverse optic capture or probably do a capsulotomy or whatever it is, but very difficult. So this is one way of taking care. Give them another problem so that they'll get distracted when you have the negative dysphotopsia. Very, very the same. But because this occurs only if you have a perfectly done surgery. If you have a lens in the sulcus, you will not get negative dysphotopsia. If you have a lens in the back, perfectly done surgery, then you can have a problem. Okay. Again, another patient can see here, post-operative picture. Again, the patient functional. You need to take care of the functional aspect. This eye, one eye was done by me. The other eye, it took only 5 minutes. The other eye was done by one of my assistants, and it took about 30-40 minutes. The patient, the patient is having 6.6 centrifugation, OCT is normal, eye trace is normal, everything is normal. Patient says, no, my left eye is having some problem, my right eye is better, whatever whichever eye you have done is better. So functional overlay is also important, but you need to make sure that you don't have any organic pathology before you label them as the functional overlay. Residual refractive error, PCO. PCO means not PCO. Wrinkle on the PC or a line on the PC. CME, do a OCT, dry eye, MGD, ocular surface, decreased contrast because of glistenings, lens tilt, and also functional overlay. I'm sure you'll have a happy patient. Thank you very much for the wonderful opportunity and the patient attention as well.